Hi students, welcome to our Wednesday and Thursday pediatric clinic. Excuse me. Today we are going to see some important signs in pediatrics. Last Wednesday we had discussed about palmar pallor. A palmar pallor indicates a hemoglobin of less than 10 grams per deciliter, and a palmar pallor involving the crease means the hemoglobin is less than 7 grams per deciliter, and a knuckle hyperpigmentation is suggestive of megaloblastic or B12 anemia, that is also we saw. And with respect to retraction, suprasternal retractions indicate laryngeal pathology, sternal retractions indicate tracheal pathology, intercostal retractions indicates parenchymal pathology, and subcostal retractions indicates asthma. So these are all the things we saw. Let us discuss about some other important clinical things today. Today we are going to discuss about clubbing, right? Right. Today let's discuss about three important findings today in your day-to-day practice. One is clubbing. What is clubbing? Let's see. Second one is trail sign. Third one is drooping of shoulder. These three important signs we are going to discuss today. What do you mean by clubbing? Look at the fingers of this child. Look at the fingers. Look at my finger and your finger. Is there any terminal enlargement? Is there any enlargement of terminal part of the fingers of you and me, those who are watching? No, not at all. But look at this terminal bulbous enlargement. Look at this terminal bulbous enlargement of almost all fingers. So this is called as clubbing. So what do you mean by clubbing? It is nothing but bulbous enlargement of distal part of the terminal phalanx. Why it occurs? It occurs as a result of proliferation of subungual tissue. Occurs as a result of proliferation of subungual tissue. What is the importance of this clubbing? Okay, clubbing means bulbous enlargement. Second one is proliferation of subungual tissue, not disease. Proliferation of subungual tissue. Yes, it is also correct by why it occurs. Okay. But before that, what are all the stages of clubbing? Let's see. What are all the stages of clubbing? Let's see. 1. The first grade 1 clubbing is due to it occurs as a result of softening of the nail bed. So this is your nail bed. It occurs as a result of softening of the nail bed. So this is your nail bed. It occurs as a result of softening of nail bed. How do you see? Look at this. So this is your child's finger. This is your child's finger, and this is the examiner's finger. The examiner's middle finger will, look at this, fix the distal interphalangeal joint. The examiner's middle finger will fix this distal interphalangeal joint, and the examiner's thumb will fix the tip of the finger of the patient, and with the help of the index finger you need to find out, whether there is a softening or not. This is grade 1 clubbing. So what is grade 1 clubbing? Grade 1 clubbing is softening of nail bed, which can be elicited by the way which is shown here. Second, what is second grade? Okay, so this is grade 1 clubbing. So what is grade 2 clubbing? So grade 1 clubbing is here. What is grade 2 clubbing? Let me show. 1 second. So look at grade 2 clubbing. So what is grade 2 clubbing? So this is my finger. Look at this. This is my finger. You draw a straight line. You draw a straight line over the nail bed and another straight line over the nail plate. Look at this. Draw a line over the nail bed and draw a line over the nail plate. The normal angle is, look at this, 160-degree angle. But what happens whenever there is a proliferation of subcutaneous tissue here? What will happen? The angle becomes more than 160-degree. Look at this. There is a proliferation of soft tissue. Initially the angle is like this, but because of the proliferation of soft tissue here, the angle becomes like this and the angle becomes 180-degree. So this angle between the nail plate and nail bed is otherwise called as low-V bond angle, commonly asked in your, this is called low-V bond angle, commonly asked in your Viva OC. So this angle is called low-V bond angle. The normal low-V bond angle is 160-degree. The angle formed between nail plate and nail bed. But when there is soft tissue enlargement, the angle between more than 180-degree, and this is called loss of low-V bond angle. So what is grade 1? Grade 1 is softening of nail bed. What is grade 2? Obliteration of the low-V bond angle is called, obliteration of the low-V bond angle increased is called grade 2. And one more method of elicitation of obliteration or increase in the low-V bond angle. How? Let me tell you. So look at this. Let me approximate two fingers. So let me take middle finger. Let me approximate both distal phalanx over one another. Look at this. There is a diamond shaped space. Look at this. There is a diamond shaped space seen in between the approximated tip of the fingers. So this is the diamond shaped space. This diamond shaped space is lost. Look at this. It is lost. So this obliteration of diamond shaped space between the two phalanxes, otherwise known as, this is grade 2 clubbing, and this is called Shamroth sign. What is this called as? This is called Shamroth sign. This is called Shamroth sign. So grade 1, softening of nail bed. Grade 2, loss of the diamond space between the approximated distal part of the two fingers. So this is Shamroth sign. And low-V bond angle normal is less than 160-degree, which is increased to more than 180-degree. So this is grade 2. And then, so grade 1 is loss of, grade 1 softening of nail bed. Grade 2 loss of low-V bond angle. And what is grade 3? Let us see what is grade 3. Okay. So what is grade 3? Look at this. What is grade 3? So look at this. Grade 3 is, again, there is increase in the soft tissue enlargement of the distal part of the fingers. As a result of which, either the tissue can extend from here to here or here to here. If it is evolving longitudinally from here to here, that is called parrot beak appearance. Look at this finger. This is called parrot beak appearance. Increase in the soft tissue in the longitudinal manner. Okay. What is drumstick appearance? Increase in the soft tissue in the horizontal manner. This is called drumstick appearance. So grade 3 is either parrot beak or drumstick appearance. Obviously, many of our undergraduates will pick up clubbing only in the presence of parrot beak or drumstick appearance. Okay, and finally, what is the last one? The last one is, look at this, hypertrophic cardiomyopathy. The last one is called as what? Hypertrophic, not cardiomyopathy, I am sorry, osteoarthropathy. So what will happen? The soft tissue will accumulate in the wrist joint, leading on to limitation of movements of the wrist joint. Limitations of movements of the wrist joint. So there are 4 grades of clubbing. Grade 1 is softening of the nail bed. Grade 2 is increase in the low V bond angle or Shamroth sign, that is loss of diamond space. Grade 3 is parrot beak or drumstick appearance. Drumstick appearance. Grade 4 is hypertrophic osteoarthropathy, characterized by the limitation of the wrist movements because of the deposition of soft tissue in the joints. So these are all the 4 grades of clubbing based on the severity. What are all the causes for clubbing? So yes, you saw a clubbing. What is the inference? What does clubbing indicate? Whenever clubbing is present, there must be an underlying etiology. What are all those etiology? It can be due to cardiac, lung, liver, GIT, etc. But with respect to cardiac cause, it can be a cyanotic congenital heart disease. You would have heard about tetralogy of Fallot. So cyanotic congenital heart disease and infective endocarditis, these are the 2 common causes for cardiac causes for clubbing. Lung, any chronic infection can lead to lung. Either it can be a lung abscess or bronchiectasis. What is bronchiectasis? Permanent enlargement of the terminal bronchioles is called as bronchiectasis. And then what are all the liver causes? Cirrhosis can cause, inflammatory bowel disease, celiac as well as inflammatory bowel disease can cause. Remember, in all these conditions, you have clubbing involving both limbs, both right arm, left arm as well as right leg, left leg. Whenever clubbing involves only one finger, that is called unidigital clubbing, and the most common cause is unidigital means single nerve. Okay, it can be either due to unidigital clubbing. Most common cause is trauma, and unilateral clubbing, the entire limb is clubbed, the entire one limb is clubbed, the other limb is normal. Clubbing involving the right hand and not involving the left hand. The 2 most common causes are median nerve injury as well as subclavian artery aneurysm. Median nerve injury and subclavian artery aneurysm. But look at this, clubbing of toes but not your fingers. In which condition it occurs? It occurs in coarctation of aorta. It occurs in a condition called as coarctation of aorta. So a small revision. So what is the small revision? Clubbing is nothing but bulbous enlargement of the terminal part of the fingers. 1. Due to soft tissue proliferation. Second point, grade 1, Shamroth sign, softening of the nail bed. Grade 2, increase in the low V bond angle and loss of diamond space, otherwise known as Shamroth sign. Grade 3, parrot beak or drumstick appearance. Grade 4. Grade 4 is hypertrophic osteoarthropathy. The causes cardiac, congenital cyanotic congenital heart disease and infective endocarditis. Lung, abscess as well as bronchiectasis. Liver, celiac disease, GIT, inflammatory bowel disease, cirrhosis, etc. And then liver cirrhosis. Okay. And then unidigital clubbing is trauma. Unilateral clubbing, only one hand is involved, median nerve injury or subclavian artery aneurysm. And the clubbing involving toes but not fingers is coarctation of aorta. Definitely this will be very useful in your day-to-day clinical practice. So by identifying the clubbing, you can find out that there is one of the underlying etiologies mentioned here will be hidden inside. So clubbing is a window through which you can diagnose these underlying etiologies. When clubbing is severe, it indicates that the underlying disease is also severe. So this is all about clubbing. Next, what is called trail sign? So what is called trail sign? Let's see what is called trail sign.
Good morning, dear friends. Let me teach you what is called trail sign. When you focus here, please come closer. When you focus here,
undue prominence of clavicle. It is not sternal head, it is clavicular head of
on the right side
sternocleidomastoid muscle.
So what does it indicates? Whenever the sternal head of sternocleidomastoid is,
I repeat, undue prominence of clavicular head of sternocleidomastoid muscle. Okay, so this is undue prominence of clavicular head of sternocleidomastoid muscle. So what does it mean? So when one also look at this, this is the clavicular head of the sternocleidomastoid. When one side is so prominent, what does it mean? It means the trachea is pulled to that side. It means the trachea is pulled to that side. Okay. Why trachea is pulled to the side? Either the trachea can be pulled or it can be pushed. Pulled or pushed. Pulled means what? Pulled means to the same side. What are all the causes that can cause this pulling? Loss of lung volume. Loss of lung volume means what? Collapse. Loss of lung volume means collapse or destroyed lung. So what does it mean? When this clavicular head of sternocleidomastoid is prominent, what does it mean? The underlying right lung is collapsed or the underlying right lung has been destroyed due to some infection. For example, in our country, you can think in terms of tuberculosis. Second, the trachea instead of pulling can be pushed from the opposite side. So what does it mean? Pushing means some other thing on the left side producing the mass effect and pulling and pushing the trachea to the other side. What are all the lesions that can evolve into? Either it can be due to air in the pleural cavity. What is that? Pneumothorax. Or fluid in the pleural cavity. What is that fluid called as? Pleural effusion. So opposite side pneumothorax or opposite side pleural effusion can cause the trachea to deviate to the this side. So here in this side, the right clavicular head of sternocleidomastoid is prominent. Either it can be due to same side pathology such as collapse of right lung or destroyed right lung, or it can be due to pushing effect from the opposite side, which is due to either fluid in the pleura, pleural effusion, or air in the pleura, that is called pneumothorax. That is called as what? Pneumothorax. So this is called trail sign. Right. So we have learnt about clubbing. We have learnt about trail sign. Trail sign means undue prominence of the clavicular head of the sternocleidomastoid muscle. Right. So I had shown some of the x-rays. As a rapid revision, you see, I'll take simple basic x-rays how to see in either next week or the week after the next one. So what is this? Lung is black in color, air is black in color. When air is replaced by something, it becomes white in color. Okay, here this is white in color. Okay, remember, heart should be on the 2/3 of the heart should be on the left side and 1/3 of the heart should be on the right side. When there is complete loss of lung volume, you will get opaque lung. This opaque lung means the lung has been collapsed and the mediastinum is pushed to the same side. So this is collapsed lung. collapse right lung. Why collapse? Because mediastinum, that is heart, is pulled to the same side. So the mediastinum is pulled to the same side. Same side. Look at this here. Again, mediastinum is entirely to the left side. So here also white out hemithorax. Again, this is collapse left lung. This is collapse left lung. So opaque hemithorax means air is replaced by something, and it will be associated with pulling of the mediastinum to the same side of the opaque lung. Now look at this. Is there any pulling or pushing? Let's leave it. Look at this. What happens here? The lung on the right side is normal. The lung on the left side, look at this. The lung on the left side, there are no vascular markings. Here you can see vascular markings. Here there are no vascular markings at all. Whenever there is absence of vascular markings and the lung is entirely black in color, this is called as pneumothorax. Pneumothorax means black lung. Without vascular markings. Without vascular markings. And look at this. This is the left lung completely collapsed by the pneumothorax. As I told you already, the mediastinum is pushed to the opposite side. I repeat, the mediastinum is pushed to the opposite side. So this is the effect that can be caused by your pneumothorax. Okay. So whenever you find the tracheal shift, it can be to the same side. Same side means collapse, fibrosis, or it can be to opposite side. Either it can be due to pleural effusion or pneumothorax. If no shift of trachea but lung is white in color, means most probably it can be an consolidation. Okay. That is, your alveoli is replaced by pus or excess air, that is asthma. This often will be useful to your 𝐌𝐿 questions. And finally, to conclude, look at this. Compare the shoulder. The left shoulder, draw a straight line. Look at this. There is a drooping of the shoulder to the right side. I repeat, there is drooping of shoulder to the right side. Drooping can be due to two things. One is acute cause, another is chronic cause. Acute cause means probably there is a pleural involvement on that side. So in order to avoid the pain, he develops that drooping. So acute drooping is pleural pathology, whereas chronic drooping means underlying loss of lung volume. Probably a destroyed lung on the right side in this patient. Destroyed lung on the right side of this patient, leading to drooping of shoulder. Probably it can be a case of TB right lung causing destruction. Okay. So with this, today we had discussed about trail sign. Okay, we had discussed about trail sign, clubbing, as well as drooping of shoulder. Thanks for your patient listening. Bye-bye.